All right, so I'm gonna ask you guys a question about what all of these pictures have in common. Over here. This is the shooting at the Batman movie. 12 people were killed in that cinema that day. This is the Columbine shooting in 1999.
Just go slow. There you go.
This is the Florida shooting that just happened this past weekend. Mac Miller, Heath Ledger, and Robin Williams. So what do you think all of these have in common?
Guns.
No. Mental illness. All these pictures have mental illness in common. When it comes from the Batman shooting, he was mentally ill. The Columbine shooting, the shooters were proven to have some sort of mental illness. The Florida shooting was actually an ex-military member who had PTSD, and the Mac Miller committed suicide. Technically, he had overdosed from fentanyl and cocaine. Robin Williams committed suicide, and Heath Ledger was found dead in his apartment while filming Batman: The Dark Knight. Mental illness is a problem that is surging in the United States. We have a lack of funding. I believe we need more funding in the United States for mental health awareness and for mental health, period. This is not a gun control issue. I am a psych nurse, and I can tell you that gun control needs to be taken out of the equation. With the Florida shooting, the man started with grenades. He didn't even start with guns. And then he had his own gun that he had from the military. He modified it with an extended magazine. So either way, he would have done what he needed to do to execute those people that day. We need to help people that are silently dealing with horrors that we can't see ourselves. And here are some of the facts. According to the American Foundation for Suicide Prevention, suicide is the 10th leading cause of death in the United States today. I mean, when you think of cancer, all the different cancers that we have, to be 10th in the United States is pretty high. There are around 45,000 deaths each year due just to suicide alone, which goes to about 123 suicides a day. And with each of those suicides, 25 more people try to attempt suicide themselves. There is so much more to mental illness than just suicide. There's schizophrenia, bipolar, depression, pica, which is an eating disorder where you have an abnormal urge to eat and stick things into your mouth. I've had patients that have swallowed thumbtacks, razor blades. They'll take pens, they'll swallow pens, and you would think that that would eventually kill them, but it doesn't. They've done it so many times that they know what they're doing. It's almost a behavioral disorder in itself. You have anorexia, which will eventually lead to death. It starves the heart muscle. You have bulimia and many more other mental illnesses, but for some reason, these people we have elected to leave behind. According to the Community Impact Newsletter, Texas is next to last in funding for mental health. The federal government for the 2016-2017 fiscal year was awarded $43.1 billion, which is a 16.2% decrease under the Donald Trump administration. However, Democrats and Republicans alike always, under each administration, are cutting funding for mental illness. So it is not just a Republican issue or a Democratic issue. They seem to think that this is an issue we can overlook and just decrease funding and put it somewhere else. In Illinois, that's where I used to live, in Rockford, funding was cut under the last Democratic governor and has continued to be decreased from there. We used to have 12 state psychiatric facilities. However, now we have 6. The only place in Rockford, Illinois that you can seek medical treatment for any kind of psychiatric issue is the 4th floor of Swedish American Hospital, which could probably fit around a little bit over 20 patients. When you consider the population of Rockford, Illinois, which is a suburb of Chicago, that's not enough. We need more funding for programs like the placement program at Terrell State Hospital. I don't know if any of you guys have ever drove by Terrell State Hospital. There are the white little houses behind Terrell State Hospital. Those used to be used for, like, if we had patients that we deemed worthy or able to be discharged, we would put them out there and we would have them get a job. They would be transported to their job to and from the hospital. We would have nurses go out there and make sure that they were in compliance with their treatment plan and taking their medications. After a certain amount of time, they would be actually discharged. This is what I believe to be a very effective course of treatment for these patients because we have a high rate of recidivism, which is a revolving door. I've seen patients in the course of 5 years, probably 10 to 20 times, just depending on the patient. Staff salaries need to increase. As an LVN, the state facility in Terrell is the lowest paid state facility in Texas for LVNs. I remember about a year ago they had brought up the issue of making Terrell State Hospital a privatized institution. They wanted to bring it into the private sector, which I do believe is a good idea. However, due to this, a lot of doctors who had vested interest in being in a state facility left the facility in order to go to other state facilities that still were there. I had a patient who came in right as our doctor had quit, and she didn't get the treatment she needed. She was passed around from doctor to doctor. She ended up signing out AMA, it's medical advice, and later on that day when she got home, she shot herself. We failed that woman. Private insurance only covers about 14 days in a psychiatric facility, and then you're looking at paying either out of pocket or being put on a state aid. We need to better be able to recognize the symptoms of mental illness so that if we have students that are showing these symptoms, we can better help to prevent school shootings, teen suicide, and drug abuse. Did you know that the most amount of psychiatric issues are in our jail systems today? I can tell you that around 80% of patients at Terrell State Hospital are forensic patients, which are 46B or 46C. 46B patients are patients that have broken into homes, stolen things, trespassed, drug charges, and then you have the 46C, which is guilty by reason of insanity. These people have committed crimes such as murder, rape and murder, very heinous crimes. My question is, why are jails being the ones to take care of our mentally ill, and why isn't this being helped in actual hospitals? This adds a stigma to people to where they are ashamed of being mentally ill. They're being treated like criminals. According to the National Alliance on Mental Illness, in an article titled "Texas Mental Health System Failed to Address the Real Problems," this issue has a giant impact on Texas. Where people that aren't even from Texas are brought to our jail systems, and we have to take in the burden of treating these people in our jail